Is this all hype or health on the internet?
Well, let's bring in the expert, Dr. Matthew Knight. He is the president of Knight Dermatology Institute. He is also a member of the Florida Board of Meds. Great to have you.
Thanks for having me again. We're talking about red light. It's everywhere. These people that look like Iron Man when they're going to bed.
Right?
And you can get like $50 ones down the street, or you can get $5,000 ones, and it's all the rage.
Okay, it's all the rage, but is it all the real? I mean,
love that.
Well, you know, so like, you know, I'm a laser surgeon, and so if you look at the literature, there is evidence that this stuff can help in like wound care. So like a podiatry clinic, it can help chronic wounds heal, or after a procedure or a facelift, it can help decrease your downtime. But the question is a mask that you buy down the street at the store going to do anything for you if you wear it every night? And I will give it a maybe score. And the reason is that it's really low energy. This is called LLT, which means low level light laser therapy. And people do this all the time. And the idea is that it can help you improve your collagen or your elastin in your skin. But is it a miracle cure? It's not. And so while it may help some people some of the time, it's not going to be this fountain of youth for folks that wear it every single night when they go to bed.
So the idea behind it is an increase in your collagen.
Yes.
And you often talk about, you know, how putting stuff on your face, right, does not increase collagen. But if you ingest it, that can help?
It can,
right?
yeah. So it's sort of like the, I've used this analogy, you can't rub feathers on a pillow to make it softer. And so our skin is really, really good at keeping stuff out. It keeps microbes and viruses and things out. And so when you put these big, like that Korean K-beauty thing, you put snail slime on your skin, it's probably not going to penetrate and not do a lot. But the point is that it can help smooth the top of the skin and make it look really smooth and nice, that glazed donut or pure skin thing that they're going after. And so it can help the way you appear, but it's not going to fundamentally change your skin. Laser and some of this LED light stuff can actually get into the deeper parts of our dermis where our collagen lives. But it's all about energy. It's kind of like a rheostat on your wall. If you turn it way up, it can have an effect, but also the side effect profile goes way up, which is why you'll only see that at a doctor's office. These home devices, the rheostat is way down, the energy is way down. It's really super safe. The question is it really going to move the needle on collagen and elastin and the fundamentals, the building blocks of our skin? Probably not, unless you, I guess if you really, really got into it and did it every single night for months and months and months, it could probably help as a bolt-on treatment. But it is not the fountain of youth, and it's not a miracle cure. And I think that's why a lot of people buy it.
But here's what I find fascinating, because you said something at the top about some of them are $50, some of them are $5,000.
That's right.
So let's say you buy, you, not me, the $5,000 one. Would that be able to ratchet it up a little more in terms of being more effective, or does that not matter?
Probably not, because this is wavelengths of light, and they're free. You know, it doesn't matter if you paid nothing for them or $5,000 for them. So it doesn't really matter if you have a light that's $50 or one that's $5,000 in terms of what we're talking about. These consumer devices, the energy is turned way down, so they're safe. So people don't burn themselves with these things for the most part. That's different than a laser in a doctor's office.
Going to your office.
Right, which these things are super duper powerful. Unless you have a medical degree and know what you're doing, you could really hurt somebody. And so most consumer devices have the energy turned way down on purpose for safety. But that doesn't mean they don't work, but they're just not going to get the kind of results that you would see at a doctor's office, a plastic surgeon's office, to have something like this done. So again, I think that it's cool. I mean, it's not total snake oil like some of the stuff we talk about. You know, if you want to add this to a great skincare routine that you're already doing, so you're already moisturizing and cleansing and maybe doing a retinol or something else, you're doing all that stuff right, putting some snails on your skin or whatever K-beauty says we should be doing, but you want to add this to that, and you also want to do it all the time and go to bed looking like a robot.
Every night? I don't know,
Danielle, it may help you.
Impacts on other things in your life, too.
It may help you.
We'll talk about that off camera. Some of those impacts.
It may help you. Yes, it may help you. But to consumers, I would say, do not spend a bunch of money on this stuff. It's not going to be the fountain of youth for what you're trying to do. But if you want to add it to an already good beauty routine, it's fine.
Good stuff. Dr. Matthew Knight, President, Knight Dermatology. Great to have you, my friend.
Always good to see you, Dr. Knight.